Emergency services, can you tell me exactly what's happened?
My mum has just come off a horse and hit her head pretty hard.
99 received, thank you.
Single responder Glennis is on the way to an SOS from a worried son. His mum has just been found lying concussed on the ground.
She doesn't really know what day it is or why she was dressed to get on the horse or anything.
Do not move her. Keep watching her very closely.
I love horses. I like watching them. I also like having a little flutter on them. But when I'm going to horse accidents, that's a very different kettle of fish.
Riding horses is 20 times more dangerous than riding a motorbike.
If this is horse country, those sirens have to go off. Horses don't go well with sirens.
A local crew have already arrived and the patient's son, Alex, is waiting to take Glennis to his mum.
Hello, do you want to show me where I'm heading? Falling from a horse is really unpredictable. On a best day, you might get a broken arm. On the worst day, you might end up in a coma with a significant head injury. They are so large, they are so powerful. It's not called horsepower for nothing. What's Mum's name?
Annabelle.
Hello, Annabelle. What's happened?
She was essentially saddling up that horse.
Yeah.
She thinks it may have touched the electric fence.
Oh.
She thinks it got spooked. That's the last thing she remembers now. She's feeling a bit of pain back the head. At the moment, there's a bit of repetitive questioning, so maybe amnesia.
Right.
Although Annabelle has no obvious external injuries, she can't remember the accident at all. A red flag for a potential brain injury.
And how did someone find you? Good question.
Her dog come over to the stables over there and got me.
So you're the neighbour?
Yeah. And my dogs, if he come on the property, usually would attack him. And they didn't.
Wow.
And I was
They
like,
could sense something.
what the hell's going on here? I turn around and there's Jacko right behind me. He's never, ever been on the property because he knows he's not allowed. He wasn't very happy about being there. He was panting and what have you. I thought, nah, this is weird. So that's why I came running over. So the horse is here.
Yeah.
So she's landed here.
Yeah, you can see where she's been. Is this the culprit?
Yeah. Feeling very sad.
Oh, I can see. Well, it's probably got a bit of a shock.
Annabelle was sitting in the middle of this yard looking extremely disorientated, and I asked her what had happened and she just kept saying, "No, who are you? Where are you from? And what are you doing in my kitchen?"
I'm going to give you a massage, my love.
While Glennis has ruled out any potential spinal cord injury, she is now searching for signs of trauma to the skull. After hitting her head so hard on the ground, Annabelle could have suffered a bleed in the brain.
One of the things we suspect is that the brain has rattled around in that hard skull. So we have to start hunting for all those little soft spots that may reveal something.
One.
Oh, yes.
Yeah.
There we go. You've got a lump, all right. She's got a large bump on the back of her head. 500-kilogram horse knocking you to the ground, striking your head. It wouldn't take much to get a bleed developing on the inside. And this could be very serious.
In country Victoria, flight paramedic Matt is trying to release the pressure in Guy's collapsed lung with an emergency needle decompression. The 56-year-old was on his motorcycle when he hit a kangaroo at 80 kilometres an hour.
Oh, mate, well done.
Any change with his sats there at all?
Oh, no, it's still 97%.
97. I think we've got more air trapped down in this area of the lung rather than up high.
With air still trapped in his lungs,
We can start moving into the aircraft.
Matt needs to get the critically ill Guy to a major trauma centre for urgent surgery.
Is he fainting?
Yeah, it's okay, Guy.
As Guy's life hangs in the balance, his wife Kim has been contacted. The news is even more heartbreaking as her husband is already battling cancer.
The last 3 years have already been a challenge. 2015, he was diagnosed with bowel cancer and then started on chemo. Just to watch someone go through that is very difficult.
1, 2, 3.
This was Guy's first time back on his much-loved motorbike since being diagnosed.
That's why I was always keen for him to ride his motorbike, because that's his passion. Your passion keeps you going, and that was a good sign that he was strong enough to get back out there.
All right, guys, let's get into the aircraft.
I thought it was just so unfair that this had happened now to him when he was just trying to get on with things.
Some big breaths for me, Guy. Big breaths.
Although Guy needs to get to hospital urgently,
Guy, can you hear me? Yeah, good man.
the helicopter trip could make his condition worse.
Any patient that's got air that's trapped inside a cavity, as I go up in altitude, that trapped air will expand, and so that will collapse his lung further.
I'll clear of the trees on the left-hand side.
And we take a gamble and we put patients in who are really, really crook, but we know that the best interest for them is to be in a place that looks after extremely unwell people.
It's all right, Guy.
Otherwise, the consequences are going to be dire.
Back in horse country, intensive care paramedic Glennis is worried Annabelle could have a head injury after her horse Maggie knocked her to the ground.
What's your blood pressure normally?
Really absolutely normal. Absolutely normal, all right.
Because we're sitting really high, okay, 190 on 100. Well, Annabelle, I would certainly like you observed.
Seriously?
Yes. You can't quite remember things and your blood pressure's really high. Okay. Annabelle's pretty adamant that she's okay, but she does need to be seen at hospital. Any head strike, particularly when you're knocked over by a 500 kilogram horse, that's quite significant. All right, let's rock and roll. Is this the hero dog? Look at you. Are you friendly? Hello. What a good boy.
It was only thanks to the bravery of Border Collie Jack that Annabelle was found concussed on the ground. Despite being sworn enemies with the neighbours' dogs, he crossed onto their property and raised the alarm.
Now that dog has stood at this fence line and barked and let that neighbour way over there know something's wrong. That's awesome. It's like Lassie.
Amazingly, the neighbours' dogs let Jack through for the first time ever without a fight.
You think after 27 years you've seen it all, but to hear of animals playing such a significant role in raising the alarm for Annabelle today, that's extraordinary. What a good boy. But we don't know how long she laid there before Jack's found her. So she's by no means out of the woods at this stage. Thank you, guys.
That's okay.
Appreciate that.
No worries.
Annabelle will now be taken to hospital for a brain scan. Hopefully, Jack's heroic efforts have prevented any long-term injuries.
Is it hard to take a big breath at the moment?
Yes.
Yeah.
In the skies above Western Victoria, 56-year-old Guy is clinging on to life. A motorbike collision left him with a collapsed lung.
I'll do a scan, see what shows up.
Flight paramedic Matt is worried the high altitude could make his patient's condition worse.
You guys all strapped in the back.
But suddenly, there's another problem.
Bit of a storm up here.
When we get a bit of thunder and lightning around, it's not the most comfortable feeling to be inside a helicopter. Essentially, you're flying around in a tin can, and obviously metal attracts electricity, so if we're flying into storms, it becomes quite concerning.
But bad weather is not the only complication. Guy's blood pressure is now dangerously low.
Suspicious that something's bleeding somewhere.
Any sort of decrease in the blood pressure that a patient gets, I get concerned about it. It makes me think, is there something else that's going on? Is he bleeding from another area? Is there something that I haven't addressed that's causing him to deteriorate further?
Alfred Hospital. We are inbound to the helipad with an ETA of 12 minutes. It's 2 minutes. No worries.
There's little Matt can do on the chopper for an internal bleed, other than get Guy to surgery as soon as possible.
All right, there's the city.
But the odds are stacking up against him.
Roger, finals checks in on. 2.
He's not cutting a break at the moment, that's for sure. He has a collapsed lung already. His blood pressure's low, his heart rate's fast, he's bleeding somewhere else.
Listen, mate, we're going to take you inside. There'll be a few bumps as we get you out of the helicopter.
So my level of concern doesn't stop even when I hand him over to the medical team at the hospital.
Well, it's a nice day.